So, so for this video, I just want to talk about the modality choice, and specifically, one of the main conversations I've had with Pete so far is just about what I mean, what cold laser can do and what he's used it for. We kind of discussed over the physiological effects of cold laser and whether or not they happen. And I mean, we've kind of reduced it down to, he's reduced it down to only a few things that cold laser has really seen. He's seen effective. So my first question is, obviously the cold laser comes with a lot of recommended areas to treat or things to treat, so that to use it to its most effectiveness. But Pete has probably only, honestly, he's only used it for uh, plantar fascia. That's his main thing. He said he uses it for his release and reduction of inflammation in plantar fascia. So I'm guessing his belief is that it's most effective on reducing inflammation and increasing blood flow and fluid release in the area of plantar fascia release and fascial releases. He said he's tried it on some other areas, such as the biceps tendon, but he doesn't believe that it penetrates deep enough to really be effective in those areas. He uses it more so for any tendinous area that would be close to the surface of the skin. So Achilles, he said he's used it on before for inflammation. He's done it a lot on plantar fascia and seen a lot of positive results on that. So I guess that answered my first question I had for him: is what do you see cold laser being effective for? My second question is, does he really believe that cold laser does all the things that it says it does? And or is it as effective as it's said to be? Because it still needs to be a decent amount of research done on it to prove some of the effects. There are some positives that have come from articles I've seen, but there still needs to be a decent amount of research done to prove anything, I believe. And that's what he says as well. His So far he says, I mean, it's effective in some things, but he's mostly used it as kind of a trial and error thing more so. It's not where he's like, oh, it says this in the book, it'll for sure do it. It's more so, I've tried everything else. Let's try some cold laser, see if it works. And in the instance of plantar fascia issues, he's seen effective treatments. So that's kind of what he's gone with over the years as he's used it. With that being said, it kind of makes me think of, sure, I mean, with modalities being the way they are, it's not whether they work or not, it's whether they work effectively or not, whether you see them as effective or not, whether you have the time to use them, whether you have the resource to use them. Because I mean, modalities are just a means to an end. It's not it's not a cure-all for anything. It's used to aid in your rehabilitation in any way. And what modality you use over one another, you just have to have a rationale of why you're using it, can you use it, and is it effective to use on that patient and at that time. And that's kind of what it boils down to with, I've kind of figured out with this cold laser. After many questions about it, it's just whether or not you find it effective based on if you the area of effect and what you're using it for. And that's kind of where our discussion ended on cold laser. It kind of still muddy water for me. I personally wouldn't use it, but I mean, if I had the time to trial it on some patients and use it in a situation, maybe I'd give it a try after ice wouldn't work or topical cooling wouldn't work. Maybe I would give it a try, but personally, I'd go about using another modality before I'd use that. And that was kind of the end of our topic, our talk on the cold laser modality.